If I talk about S1, it is because we have two valves in the heart. One is the tricuspid valve and one is the mitral valve. And obviously we have the pulmonary artery going here and the aorta going here. So pulmonary artery will have a semilinear valve and same as the aortic valve. And whenever the tricuspid or the mitral valve closes, that is that produces S1. And whenever we have the closure of the pulmonary valve or the aortic valve, we have, if it closes, we have S2. See, there is a little bit lag between the closure of these two, so it is not one voice that is S1. It is, we can say it, T1 and T1 for tricuspid and M1 for mitral, but it is not that long lag that we can appreciate, so we do not say it as T1 or M1, we just say it as S1. But in the case of S2, we have pulmonary valve and the aortic valve that closes and have a significant interval between the closure of the both. So we can hear the aortic valve first, that is A2, and then we have the pulmonary valve that can be heard closing, and so we have P2. So we say that there is a2-p2 split. Now if you are a new student in the world of cardiology, you might not be able to appreciate this a2-p2 split. You will be just able to appreciate the lub and the dub. So it's normal, it's okay. It only gets into your mind whenever you try to hear and you practice a lot. Okay, so this is about what is S2 and what is S1. Now you might think that why the A2 is closing before P2. Now this is because here we have the aorta in which the pressure is very high as compared to the pulmonary artery. So what we have is whenever the ventricle is pumping, only very less time is taken, that here the pressure and here the aortic pressure equalizes, and this high pressure which is already present in the aorta, it pushes the valve back and closes it, whereas here the pressure is not that much. So a very large time the ventricular pressure will be much higher than the pulmonary artery pressure, so valve will be pushed in this direction most of the time, so it will be open. When this pressure and this pressure equalizes, then we can think of the valve closure process to start. And when this pressure actually increases as compared to this ventricular pressure, then only it pushes the valve back to its normal place and closes it. So whenever somebody asks you that why A2 closes first than P2, your answer should be that on the left side between the aorta and the left ventricle, the pressure equalizes much earlier than the right side.